I'd like to call to order our special call meeting today, May the 1st, 2019 at 5:30 p.m. And I'm sure Ms. Dye is on her way. Next item on our agenda is put people first. We're going to hear from Ms. McCoy about the nursing contract and employee contract.
Tonight, we're not making any decisions. We're just kind of talking this over about what this nursing contract looks like. The nursing contract is linked up there. It is the same as last year, except this year you are being asked to consider that there is in this contract the option for Cumberland to own our school nurses. So right now, they currently pay 30%. They pay all supplies, and they pay us 30% of our school nurses, and we employ them. And we'd be approving the option for them to own our school nurses, and we still pay them. So in verse of them paying, think about this, them paying us 30%, we then pay them 70%. Does that make sense? There's no money loss, it's the same. So let's look at the slide, it'll help explain. Right now we have 9 comprehensive school nurses, and we would like to increase that to 10. But the financial sustainability over years creates a little bit of dilemma with school nursing. As we see across the state, it's very hard to find school nurses. We see that. This partnership will allow us to fund 10 because of the savings that we ultimately have. They're also going to add a nurse practitioner to us. We currently have 1 nurse practitioner. They want to add another one to help serve our students. We need it. Our referral numbers are there. And they said we need to be able to provide you a nurse practitioner. And so we want to continue that foster relationship between us and Cumberland. And so if we agree with the option that they may employ our nurses under this new contract, everything ultimately stays the same. We still have a director of nursing services as the bridge with Cumberland. We also have a regional director that will be partnering with us. They will provide benefit packages to all of our Cumberland employed nurses. They provide liability insurance. And there is a plus side for them. So they see their numbers increasing for referrals across when they're in district. So we know that there's a financial side of their business. They would like to say that they do all of this out of the goodness of their heart. There is a financial side. And so they say there's a higher likelihood of our referrals going even further up. And we know the referrals don't just mean money to us. It means kids are having access to health care and getting treated. And so the higher that goes up, the higher their likelihood of paying more of our school nurses. We get that. They're making money too from this. So.
I think too, it's safe to say, based on the conversations that are happening around the state, the healthcare and schools conversation is not going away.
Right.
The federal government's involvement in that is not going away. Our state government's involvement is not going away. And I do feel like this is going to be a recurring theme over the course of the next few years. And there's going to be more and more opportunities to provide students access. And I would say there's going to be more funding to support that. I say that just to really condition our conversation and knowing that these conversations are happening across the state right now in a number of districts, and I think they're only going to deepen over the next year due to some of the conversations happening at the state level.
I think I don't know if you all made the decision to put this many nurses in our district. It's a phenomenal thought, whoever made that decision. And we realized over the last year, we have to have these nurses. The number of diabetics are increasing, and just major services that have to be offered to our kids. We need this level of care in our district. And so for us to be able to financially sustain it over the years, I think it's beneficial for us to look at Cumberland and what they can offer us. Their partnership is extreme in the fact that they provide all of our supplies. We don't pay for anything except we paid for CPR mannequins this year. And they provide everything, bandages, medication, everything. And for us to be able to sustain that's very difficult on our own without a Cumberland partnership. And you see below here kind of what the foreseeable costs could be and the savings is that if we own the nurses, the cost to us is really $460,000. We pay $322,000 of that relatively. If Cumberland owns them, the cost is around $418,000 and we only pay $288,000. So we are saving some money there. The days are the same, the hours are the same, and Cumberland has said there's a bigger likelihood of us being able to increase our funding for your program because we can increase referrals faster.
Is that what you were getting at earlier, is that lower
That's the
right
50%.
box?
Mhm.
Yeah.
Yeah.
So is this one here, regardless of which column, um, based on 10 nurses
Mhm. It's based on 10
plus
nurses.
a district coordinator, whatever phrase you use?
Yes.
Okay. And whereas now it's 9 plus a district coordinator? Okay.
But our district coordinator, she is also a
A
school
nurse,
nurse.
yeah.
So we pay her a little stipend,
Right.
and Cumberland's willing to take on that stipend. So,
Yeah, because I was looking at the math there, and the cost on the left. Are they getting paid the same amount?
they're getting paid the same amount. This cost on the right is Cumberland is in contract. We'll know tomorrow for sure whether they're going to give us one of our nurses for free, that 10 nurse for
Okay.
total for free, for them to be able to provide that. Because they see, we had one nurse that served Bloomfield Elementary and
And
Bloomfield Middle this
Bloomfield.
year, and they could not make the referral numbers
Mm.
because she was split. And we had some health issues in Bloomfield that we need to service those schools with a nurse. And so we will finalize that tomorrow. And that's why I say, let's wait to make any decision because we'll find out that tomorrow.
So is this, these numbers, is this over and above salaries, or does this include salary?
These are salaries and benefits.
That's everything?
That's everything.
Salary
you
and
correct me if I'm wrong,
benefits?
We did that with everything.
It's salaries and
Salaries and
benefits.
benefits.
Salary and benefits.
Yep.
Has Cumberland Health, or maybe things that you've seen, I know you and I have had very, very short conversation about telehealth and the rules that change
Yeah.
come July 1 with the reimbursement requirements. Has Cumberland said anything whether or not they see that might also be something
For
that?
telehealth,
Mhm.
we haven't talked much about it. I'm willing to get into that conversation to see what that looks like.
Yeah, I know the telehealth from, I'll call it the physical health piece, where we're situated probably is not as big of a enticement as rural Kentucky,
Right.
where you don't have access to literally the nurse practitioners or the physical doctors themselves. But like you were saying earlier, whenever it comes to the overall health and well-being of the child, it's not just going to be the physical element, it could be social, mental issues going on as well. And of course, then you're talking about specialists and being able to reach out to them through telehealth services.
We have talked about this. We have not, we do use teleservices for, we don't use them, but our providers like Rivendell and Our Lady of Peace, the Brook can use telehealth for mental health, and we do use those services. Those are not, we don't have to pay for them. That's the only time I've used telehealth is with mental health,
Yep.
but physical health is something we have yet to explore.
Yeah, well, and again, the physical health piece, I don't know that would play into it as much here, especially if we were to move towards 10 nurses situated throughout the district. But, you know, the ability to get equal reimbursement rates from insurance
And that's the big conversation.
with telehealth
Yeah.
after July 1,
Yeah.
especially if you're talking about social services, mental health services, and being able to make that connection to, you mentioned 2 or 3 names of providers that we partner with, that we might see those types of services being able to be leveraged
Yeah.
even more.
Yeah, so, any questions for you guys? You can say.
I don't, we did, well, Diane did some calculations, and the average income for a nurse is 34,000, and that's
No,
it?
that's just the difference between that and that
I mean,
number and that.
okay, what's the
I would say it's
average?
approximately, that's approximate
That's what I'm
average.
saying.
So, okay. So if they own the nurses, then they're paying the nurses. Why is our fee still so high?
We still have to pay 70% of the costs this school year. They want to take that to where we only pay 50%. So that's one of the incentives, is that they will eventually pay 50%. But right now, we still have to pay 70% of the nurse.
So
Does
there's,
that make sense?
Okay.
so they're funding 30% of the nursing
Nursing.
services regardless of whether we own the salary and
Or
benefits, or
they
they
own
own the
it.
salary and
That's right.
benefits.
But this is for.
Now, I know they're not gonna be, but last year when she came up here, that young lady.
Yes,
and
Ibby.
said that we wouldn't pay anything. I mean, it was all free. It's anything that says too good to be true.
It's too
So
good to be
that's
true.
why I'm saying, there's got to be a catch
No,
somewhere.
no, what she got at about the free maybe that you might be remembering would be if the reimbursement rates started
Started.
increasing,
So,
then
yeah.
that could offset our cost.
Yes.
Because we have a cost, no matter what, that 70%, which could go down if
So they
the,
want to go to 50%, and now they're seeing their districts that have really, they're employed by Cumberland, they're seeing their numbers go down, they're at like 95% for some districts, are at 100%, and they're paying for their school nurses. Because the referral numbers are allowing them to absorb the cost and benefit themselves from it, so. And they'll be able to tap into Medicaid next year too, and so that allows the conversation to even change further. So think about immunizations and what we can do for kids there with their Medicaid.
yeah.
and-
So does that make sense then? I mean, it wasn't necessarily that we would never pay anything. It's
Oh,
that
no, I didn't-
potentially the reimbursement rates that could come in from having additional nursing staff could offset the cost we had of the nursing.
I would argue that as we continue to deepen the conversation and build trust with our families around this model, because remember, a year ago, this was a new conversation.
Absolutely.
And the school nursing model was not something that we as a community have relied upon as our primary caregiver by any means. I think over time, that's going to become much more common.
I mean, I know last fall, I guess it was, whenever the flu shots were being offered, I think, was there a cost to it for the students? I can't remember.
For a flu shot?
Yeah.
Yes, well.
But the parent wasn't paying the cost, it was
Right.
somehow getting,
Absorbed by
absorbed by
because
Cumberland, yeah.
They could have used whatever mechanism
yeah.
they use for
And
payment.
why I bring that up is because whenever I saw Miss Stivers from Nelson County High School send out her daily email with that in there, I mean, my radar went off and I'm like, okay, where's the paperwork?
Yeah.
Daniel's gonna get him a flu shot.
Well, and I think
and-
they charge insurance. They bill
Sure.
everything with insurance, so
But I
I'm
didn't-
sure
we didn't have to
insurance are-
schedule an
Right, we don't
appointment,
do
we didn't have to go to the
anything.
Kroger, immediate care or anything.
Right.
Yeah, he was able just to walk down the hall and get his
the
shot.
Flu
Yeah.
shot, the dental care that we offered this year was the same way. My children experienced flu shots, dental care, everything right there in the school. And we can arrange that now.
The-
But it's not really about our kids, just our kids. It's about the kids that have never taken
Sure.
anywhere. They never see anybody,
I
and that's
know,
their only
I think it's a great
access.
program, you know,
Yeah.
you know, I
What-
really think we need it.
Well, and they're not taken because they don't have a primary care, or they don't have the insurance, or the parent can't get off work to schedule the appointment that they then have to take their kid to.
Right, and so also Cumberland is federally funded as well, and so they get access to funds. So our kids who can't afford it, they take on more hardship cases than our local clinics would be able to take on and be able to write off the costs for.
So did we
But
get any of those reimbursements like back this year? Have we got
We
anything?
yeah, well, we
Yes.
get Medicaid.
No, we are also
You
getting
mean
the
the
30%
30%.
back,
We're getting the
which is about
30% now.
$8,000 per month.
Yes, is what we get back.
Basically, essentially what they have there on the left side is what we
Okay.
got this year.
Okay.
I got you. Okay. So something to consider, and at the board meeting, we can approve it, or whatever you all want to do, and we can be in conversations between now and then to see if you have any more questions.
Whenever you come with this at the board meeting, will you be kind of making a recommendation based upon other information? Sounds like you're getting
So
here.
I've talked to a couple districts that have been doing this, and they are, I have a recommendation that we accept this, but think over
Which-
conversations
which
together,
one?
we could, that Cumberland owns our nurses, employs them, because of the likelihood of financial sustainability of the years, but also to increase healthcare access. They're able to provide us flow. For example, I've never been a nurse. And so they're a district nurse coming in and kind of lining our programs and saying, this is what flow looks like to make referrals for kids, to get more kids in and access to our healthcare services. That's a big one for me. Also, I can't deny the luxury if they're willing to provide us another nurse completely free of charge. I don't know how I could turn that down. So we'll learn tomorrow whether that's going to be the case, and we can be in, I can let you all know.
Okay.
Yeah.
Good job.
Right. I'm also the next one too, so I'm just going to sit up here, I
Yep.
believe.
Lincoln Trail Health Department partnership.
Yes, okay, so a long time ago, under I think 2 superintendents ago, it was signed that we would contract with Lincoln Trail Health Department, the District 1, to be able to serve Nelson County High School, to serve as the emergency services crisis building if something were totally to go awry in our district or in our county. And so that we would open our doors for them to dispense immunizations and emergency medication, and they would use our building for that. And so they're asking for us to approve that again. And we approve that memorandum of understanding that they have access to that building if a major catastrophe were to happen in our county. So that's just asking for approval, and you will grant that at the board meeting. So any questions regarding that? You feel good about?
That agreement's been
It's
done
been
for
years
years.
and we've approved it for years, so, yeah.
It's the biggest location in the county.
It is, yes, with access to chairs, tables, everything that would need, bathrooms.
Restrooms,
Yeah.
kitchen.
Yeah. All right, that's all for me.
Okay, thank you. Our next is Ms. Hanloser, and she is in charge of the community center evaluation update.
It is. Oh, make sure this is on.
It's a button, you just gotta turn it on.
Oh, sorry. It's on the side. Sorry.
Ms.
I just-
McCoy left
I
you
just
hanging.
assumed it was ready.
She left you
She didn't
hanging.
need to use it. She just had one slide. so. Hey, it's going to work. Okay. So we really just want to, update you on what we've been working on, and this has been something that's been evolving all through the year. So you know that in March, we asked you to approve 100 revised job descriptions, and we told you at that time that not only were we aligning those with the salary schedules, but that in May, we would be sharing with you how those will align to our evaluation process. So that's where we are today. So basically, the process has been, as you can see in the blue and the red there, that we wanted to outline the essential functions of each job, and we wanted to make sure that that was aligned to our published salary schedule, so it's very easy for employees and potential employees to find how much they'd be, how much they're making, what salary schedule they're on. So that piece has happened, and where we are right now is in the gray part of this process, where we're now looking at aligning the job description and the essential job functions with an evaluation system that promotes ongoing collaboration and growth. So what I wanted to do is just take you through a couple of examples. I'm going to give you a certified example and a classified example. And we're doing a lot of work with classified, as you'll see when we get to that point. So basically, if you're just looking at this left to right, this initial document, this job description that's been approved, that's static. That is what the job description is, and what the expectations are. And so we told you that we would connect that to an evaluation and reflection tool that would allow us to have a summative rating for employees on their evaluation. But this piece in the middle is really where we are working right now, and where we have been working all year, is this fluid piece that we work with in collaborating with teachers and principals and employees in general on that growth piece. So this is the ongoing collaboration that feeds into that final summative rating at the end. So what I want to show you is just an example of a certified piece of this ongoing collaboration, and then a classified piece on that. So this is what an employee will see in their evaluation plan next year, and all of these things have links so that they can very easily in a one-stop shop get to all the documents that they need. And then they'll be adding documents and links to projects that they're working on or things that they're growing in on this ongoing fluid living piece. I just chose a backpack leader. We have several of those posted right now. So when we think about the backpack leader, and based on there's those individual, these are your responsibilities on the job description, but what does that look like more holistically as a backpack leader when you think about the big picture? So this is the flywheel for a backpack leader. And then this actually feeds this living piece here that, that they will use with their evaluator and for themselves all year long. So for example, Mr. Bradley and Mr. Goff have tri-weekly meetings with the principals, and we call those Pride Points. Evaluators in schools have tri-weekly collaborations with their employees as well, with their certified employees at this point. So this would be the piece, and Chase is going to talk about this and flesh this out a lot more during his Ignite at the board meeting. But so you've got the district goals here over on the left, and then a backpack leader. So if I'm a backpack leader at one school and you're a backpack leader at another school, I might even have some different school priorities based on where I am and what is needed and how that matches and promotes the district initiatives as well. So this is just a place where, this is a one-stop shop where I would have all kinds of links, I'd have dates, I'd have things that I'm growing in, things that I'm celebrating, and I'm having a conversation with my evaluator tri-weekly on these things. Like, we're staying in touch, fingers on the pulse. And then that eventually feeds this final piece. So this is actually what would get uploaded into a personnel file, which will be digital. At this time next year, we'll have that all in place. But this is the piece that would be the summative rating. And you can see that they've got a link to their job description, they've got a link to their performance standards, and those are different depending on what the position is, whether I'm a teacher, whether I'm a backpack leader, whether I'm a library media specialist. Those rubrics are different. So this is the other piece that is static, so to speak. We're not going to change this and pull the rug on people. We're going to do our collaboration and our growing in those documents that I showed you previously. So when we go to a classified build out, currently our classified evaluation is like just about every other one that I've been able to find on Google in the state for every other school system in the state, and it really is, it's quite simplistic.
The paradigm shift is that we went from one classified evaluation document to customized classified evaluation document. So a bus driver, for example, would have a custom evaluation document for transportation. Maintenance leader would have a custom evaluation for maintenance. That's the shift that we're making, which is an important one, and something that is going to give us, we feel like, a lot more value in our collaboration process.
And when you talk about, you know, the standard one that you did the search, the first thing that comes to my mind is, here's these indicators, 1 through 5, circle which is the appropriate one, or here's these indicators, novice, apprentice, proficient, distinguished, something like that.
Well,
Is that
it's actually a little less
even
sophisticated than
simplistic?
that. It is meets, does not meet, exceeds.
Okay.
So there's really, that doesn't promote growth, and that doesn't open up conversations, you know, well, I'm doing it or I'm not doing it. And I don't know how many people at a job either do it or not do it. There's some level of performance in there, right? And proficiency. So classified, this is an example of what we now call a registrar, but they will be called school family caretakers. So again, they also will have this flywheel that gives them their holistic view of their job based on their job description. They'll also be working with their evaluator. It's not just at the end of the year, we've got 3 weeks before the year is over to get all these evaluations done. Check meets, check does not meet, check exceeds. So getting them involved in those conversations and having those goals very much like we collaborate with certified folks.
The key piece in this, we've talked about coherence. How does the system around the work feed the work? So deep learning, they talk a lot about the systems change. Everything around it has to support the conversation. So if you go back to that slide, the key piece, we've talked about backpack days next year. We made a decision, and you as a team supported that decision to allocate additional days for collaboration. At the beginning of this conversation, we're already looking towards how are we using those days to align to these values. Because if we wait till August 2nd, or let's say September 15th, the day before, it's like, what are we going to do on our backpack day? We know we're going to lose value there. So that coherence piece is so important. It also reshapes people's understanding of their job. They look at, we really want everyone to think, okay, I'm looking at this more holistically. This is not what am I doing this week, it's what am I doing this year. How am I contributing as a leader in this conversation?
And are they helping support the district goals?
Yes.
So again, this would be the summative piece. So I talked about the check I meet, check I do not meet. So this is just the beginning of a rubric of levels of performance that would be much more informational for an employee, a classified employee. So just to give you an idea of where we are, we had 100 job description revisions, and so now instead of everyone having the same evaluation, every classified employee having the same evaluation, we're building those out so that it meets what we expect in their job, and so for them to be able to grow and improve and move into more leadership roles.
So will there be a customized one for every job description that has a different name to it?
Almost.
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 Some
Close.
redundancy.
Yeah.
It has some redundancies.
Sure.
Some departments or some areas do lend themselves
They
to
mirror
some
each other so
redundancy,
much,
and then
yeah.
some do not. Like I talked to Jessica today, Jessica Hogue, and she said, I've tried to consolidate it, but right now I have 3. I have a cafe cook, a cafe lead assistant, a cafe manager. They're all very similar, but she felt like she needed to do some differentiation, and she has the ability to be able to do that because we have the construct in place. So, that's where we are. Any questions?
So this is a team effort, and there are 14 people really that are involved in this process and continue to think about how they can do it. Robin's meeting with them individually, they're meeting in teams. It's a big undertaking, but I would argue it's probably some of the most important time we can take because it shows that we're putting people first by investing in them and their professional growth.
Very good.
All right. Hey, this is on now. Whoever's next.
Say you can speak, but I don't need a clicker, I don't think.
Okay, Ms. Tiffany Clark.
Okay, so I linked on there too the job description for a diagnostician. So this is something that Nelson County Schools, for the last 6 years, I don't think we've had one. I think previously there was. So they actually support the school psychologist. So school psychologists, we've really looked at what their roles are in schools, involving them more in caretaking with students, providing some sessions, small group sessions, counseling kind of things. So with that takes them away from some of their other responsibilities on the gifted minds end. So anytime a student is evaluated, there's a process for that. There's observations that have to take place where they document what students are doing. There's also other achievement tests that take place as a matter of just literally asking a student questions and having them respond. So in order to give our school psychologists some support so that they can do these things in schools, be more involved with our students, a diagnostician, and we're looking at this as a part-time position. It's a 3-day-a-week position, and they'll go where the need kind of is where their need is during that time frame, working with all of the school psychologists. And what their main role will be doing observations in classrooms on those students and providing that feedback to the school psychologist so that they can write the report and determine if they're eligible or not. They will also provide some achievement testing. So the testing that is very scripted, they would provide that to the student and then give the results to the school psychologist for the report. So we don't have to vote today, or we don't have to decide today, but that is one thing. And then IDEA will be the funds that comes out of, and that, again, that's just by rebudgeting, looking at what we need for the district next year and changing some things in that. I think, was it like around 22, maybe? Do you remember? I think it was around 22,000, I think.
I believe we were basing
But
it on
without,
this.
yeah, because it wouldn't have benefits or anything like that. It's just a part-time. That would be if it was like a certified position. So a certified teacher as a part-time, no benefits, anything like that. Or a retired teacher, anything like that. So that's kind of what we were looking at. So yeah, it's no benefits or. It was based off the certified salary schedule, just on 3 days and no benefits. So.
Okey dokey. Now, we got Ms. Clark again with the Gifted Mind Great Leaps Agreement.
Yeah, so this is also good news. So Dr. Kara Ackerman is the board certified behavior analyst that we use within the district. So she has some ties with UK, she works for UK, but she also does with University of Louisville. So she reached out not too long ago and said, hey, I didn't know if Nelson County would be interested in this opportunity. We're going to run a new study with Great Leaps. We've used Great Leaps in the past. It is a literacy program, and we're really focusing on K2 literacy. So when she started talking about literacy, I was like, tell me more about this. So she said, actually what it would be is we would focus on 1 or 2 teachers in a building, and that teacher, I've reached out to principals on who would be interested in this. So we've identified that person and they're willing to do this. So they would provide all the training, all of the materials for the teacher, and they would use this program, and then we would give them feedback on the program and the progress of the students involved. No fees, just something to keep you guys aware of.
Just a one-year pilot.
As far as I know, yeah, they're just doing a research study, and I said, but we need somebody willing to do it, so we'll give you all the materials and the training if you guys will be kind of our pilot, so. So I think they're just focused on, I think it's online, like the new versions are more online based, and they want to focus on gifted mind students as well. They want to focus on a smaller population. That's it for me.
Okay, thank you. Next is Ms. Owens with our Dedicated to Our Community, and you had several issues, not issues, but several Section 125, diesel and gasoline, banking services, and tentative budget.
I only have a few notes. I'm just kidding, I'm kidding.
Round it all out.
Most of this is actually going to be pretty easy tonight. So the Section 125 plan was approved at the last board meeting. It was the RFP for a new plan administrator. Doesn't mean we're going to change, but it is putting it out there to see what other companies have to offer. That those were actually distributed today. But what we are hoping for is to have somebody appointed from the board to participate with us in the review process, because this is something that affects every employee, and we'd like to have another party involved in that discussion. And so it was decided to wait until this board meeting to have that discussion. It doesn't need to be voted on until the actual board meeting night. We won't have anything to review until the end of June anyway. But we would like to open the discussion to have somebody appointed from the board to participate in that review process.
And the conversation, just to rehash this, Diane talked about possibly being a part of that conversation. And Rebecca, I don't know if I talked to you about this or not, but the other conversation was, due to your expertise and the work that you do, that you would make a great addition, even if that's through Google Hangout or wherever it is. I'm just summarizing the conversation.
I thought I'd let them.
Basically, it's a cage match between the two.
Oh, no, actually, I thought that she'd be better qualified. I did.
That is what Ms. Reading
It
told me.
is, but we didn't want to make a decision at the last board meeting because you weren't here.
Yeah.
They didn't
Because
want
we
to
would never hear the end of it.
Well, I just think
So-
we've got the familiar grounds with
So-
the insurance companies.
So I will say that the plan is that we would do a review of the actual paper proposals or digital proposals that were sent at the end of June. We would invite a minimum of 2 companies back to actually do a presentation. It could be more depending on what we saw, and then we would ask that person to be involved in those actual presentations as well. So.
And that's where we kind of thought, well, maybe do a Google Hangout or a Skype session and make it easier.
So then, at the board meeting, we'll be asking for that appointment. I'm sure there'll be a recommendation for you, Ms. Dyke. So that's what we're asking. See, that one wasn't so bad. All right. So.
That's your wheelhouse.
Yeah, that's an easy one.
Thank you. You're welcome. So the diesel gasoline. So the diesel gasoline fuel bid, that was a bid opening that occurred on April 19th. We will be recommending that it's A&M Oil Company be awarded the diesel gasoline bid for the 2019-2020 school year. And this is just routine stuff. We'll do this every year. That was the bid that won out, and we did check references on this particular company because it's not one that we've used in the past. Jeff called some other locations to see, and everybody was perfectly happy working with them, and so They have several different sites, some fairly close, and there was wording in the contract that if at any point they are unable to provide us services within, I believe it was 24 hours on a regular basis, that we do have the right to seek outside resources to get fuel, because we have had issues in the past where somebody's not been able to deliver in a timely manner, which causes problems for us. So we'll be making that recommendation at the board meeting. That it will most likely be in the consent agenda because it's just an award of a bid, but
Were they low bidder, not necessarily across the board on every area, but based upon whatever, they were the only? Okay.
In the event.
but we did check them out anyway. We completely evaluated everything and checked them out.
Are they based in Taylorsville, or is that just where one of their locations?
That was one of their,
is?
that's their main location. They
Okay.
actually had,
Who is it?
it's A&M Oil Company.
As you go into Taylorsville on 55, it is on the left, right before you go down the hill.
But they have E-Town and Shepherdsville. There was 5 locations, all very close to us.
That's good, it's local people.
Yeah. Yep.
Was there any rhetoric in the event that we did, when we couldn't get services, that we had to expedite another source? If there are costs involved there, that would be
No.
captured somehow or other?
No. It just gives us the right to seek outside resources if we need to. In the event that it's at some type of national emergency, they still have the right to continue the contract as long as they're able to be up and running within 30 days. But in the event we had to get it from an outside agency, it wouldn't cost, I mean, might be a different price, but it wouldn't be like a rush cost or anything like that. We have local, or people that are local who know where we could do that. All right.
We don't take the bid, but we do get gas that cheap personally.
Yeah.
It was, and it is up there for you to see if you want to see that. But, so banking services, again, another routine thing, happens every 3 to 5 years. We are currently with WesBanco. They did come back with, to address some issues that we were currently having. Currently, we are not receiving interest on our first $5 million worth of funding. It's based on a sweep account thing. So in this proposal, I requested that be adjusted. I made several other requests as well, but all of my requests were actually addressed in the new proposal. Not only that, but there's some security features that they'll be providing free of charge that they normally charge $75 a month for, and that would be per location. The interest rate that they have recommended is higher than what we're receiving. It will increase our investment income, but we're recommending that we continue the relationship that we have with WesBanco. We've not had any complaints or issues, and they have addressed those few things that we wanted to address. And so at the board meeting, I'll be asking for your approval to continue that relationship based on this.
Last year, I think there was a total of like 18,000 in interest and stuff. We got some good interest
It
or
was-
something. It was big dollars.
It's quite a bit more this year, but it's
Yeah.
gonna probably be even double than that the following year.
That's what I'm saying. I remember when Tim said the moment, because we were not receiving any interest.
Exactly.
So when a bank tells you, oh yeah, you get 18,000 or above, and we're going, okay, we'll take that one.
So based on the estimates, based on our current balances, would be a little over 200,000.
A year, yes. I just remember him saying when he said that, particularly because I think we were with Farmers or whatever, and, or maybe Wilson.
Town and Country?
Town and Country, well, it's been renamed,
That's what I
but we weren't receiving any. And
Oh, yes.
That bothered me anyway. mean,
I
when
think
you sign
that
a contract-
we're such a small community that it's difficult to find a bank that can manage our accounts. So
Yes,
that's
yes.
been, I think, one of the downfalls. And we had a time period where there wasn't a whole lot of growth, and all interest dropped for all school districts across the state. There was quite a few
It's been
districts that weren't. renewing.
2008 or 9, my first couple years on the board, since we've been able to see numbers like that.
Yeah, it's definitely a strong vote.
Well, the $75 you mentioned,
Yes.
that you're not gonna be charged, they're probably gonna charge me, because that's where I bank. So,
Okay.
I'll tell
Good.
them. Yeah, I'll get that
So that-
back, $2 a month or something.
That was actually another one. We actually requested that all fees be waived. So currently,
Oh, well,
we
that's
have
great.
currently our schools are charged after a certain number of transactions,
Yes.
and I have removed all those. Any fees that we had, stop payment fees, they were being charged to that interest that we weren't receiving, all gone. So basically, absolutely no fees, interest on all money, and security features that we don't currently have that will be free of charge.
They're huge things. I mean, they keep buying and buying, so. yeah.
They are doing that. I think
They're
they've combined with
buying
another
later.
one now, so.
Yeah.
So anyway,
Yeah.
that, you'll be asked
Good
to
job.
approve that at the board meeting, so.
Good, great job.
All right, tentative budget.
Yeah.
All right, so the tentative budget provides a financial framework for us, basically, for the new school year. This is the midpoint in our budgeting cycle. Of course, when we do the draft budget, we have so little information that we're pretty much looking at trends and just analyzing, trying to figure out where we think we're going to be based on those trends. We don't have enough information to do anything beyond that. So then by the tentative budget, we've actually received quite a bit of information. We've had preliminary estimates for our property taxes. Growth factor's been calculated. At this point, we've done staffing allocations. We've done our salary schedules have been created. So by the tentative budget, we actually can create an educated estimate of what our expected revenues and our expenses will be. So you saw this chart back at the draft budget, just to kind of show you that trend in state SEEK funding. I just wanted to bring your attention back to that. We have had approximately $4.5 million reduction in SEEK since 2009. An increase in state mandates that are not funded. We've had an increase in CERS and KTRS expenses, and so I just wanted to bring your attention back to that.
I think too, if you look at the estimate for 2020, it continues the downward trend.
It does. Yes, it does. So we're going to be expecting approximately $1 million in increased tax revenue, and that would be based on 4% revenue increase. State SEEK funding is going to most likely drop if our enrollment doesn't change, and that is because of our assessment. A lot of people think that when you increase your tax rate or your tax revenue, that's what causes the SEEK funding to drop, and it is not. Your assessment is what causes it. We have no control over the assessment. That's the PVA gives us the numbers. That's what controls the state SEEK funding. And so we do expect a decrease in that. The rest of our funding, which is just a miscellaneous things of like Medicaid funding and interest and parochial transportation, those types of things, it'll remain pretty much stable. There's a slight increase, and that'll be because of our investment income. But our anticipated revenues will only be about $600,000, $650,000 higher, based on the offsetting of the SEEK and the tax revenues. So the discussion around the tentative budget has been focused on our district priorities. Where are we currently spending funds? What expenditures need greater alignment? Where can we reallocate to make those, to address those priorities? And we've done this throughout every conversation we've had over the past few months. We've talked about it during staffing allocations. We've talked about it during salary schedules. We've tried to summarize some of those points that we've been focusing on, so that you can review. School counselors, we discussed that during staffing allocations. Backpack leaders, we discussed that during staffing allocations. K-2 literacy specialists, we've discussed. During the salary schedules, we talked about the student leadership and the teacher leadership funding. Earlier this evening, you heard about the nursing services and the ability to possibly provide one at every school. So this conversation has been from the beginning, and everything we've done has been built off of this conversation. And so as we move into the tentative budget, for right now, I've created a summary for you to kind of show what that estimated revenue, how that's going to be divided out. That's about 78% is about into salaries. That's a state average of what they recommend. If you only have that much in salaries and benefits, you should be able to fund all of your other costs, and so that's what this is based on. And then the non-salary expenses are divided out into various areas so that you can see how much is, I'm sorry, go ahead.
That, you said 71?
78%. They recommend below 80.
Yeah, 80 to 82, I think was the last time I was.
Well, they said that most school districts are at that point because with dropped funding, they've gotten up to that point. They recommend below 80 is what I've heard, unless something's
Because
changed.
once you start getting over 80%, that is a recurring annual costs that the only way to cut is cut people.
Just to cut
And so
Like
there's
stay
always
below
that
that.
danger for districts that start pushing above 80% that they're, I don't want to say they're people heavy, but if something happens, they are people heavy. That's the only place to start really making big cuts. Yeah.
So as I looked over the past several years, we've tried to maintain somewhere between the 76 to 79%. This is at about at 78. So
It's closer to 80 it's close to 80.
it is close, but it's not there. And 1%
Yeah, and
is a large amount for our budget.
Yeah, it's about 3 teachers.
So then we've divided out the non-salary expenses just to give you an idea of where those costs go. In addition, the Section 6 allocations, which you've seen before, we had talked before about making sure that you could see where the schools are using their allocated money. There's a link down here for you to be able to click on that and see that. There's only one school linked right now, but as they are finished up, that will be linked so that you can see.
We've been working with the schools to simplify that communication structure. So basically, when you click there, you'll be able to see school priorities and how they've aligned the budget to it, because otherwise you were going to see a bunch of spreadsheets. And it was from Eunice, it was written from Eunice, so we're trying to simplify that. Because there's so many different schools, we're just trying to make that. So. And it's really allowed us. So in, maybe it was in January or February in this conversation, I think Rebecca said, how do we know how the spending is occurring, and how can we ensure that it's aligned to priorities? And that allowed us to have some better conversations, to get to a point where we're really, when we were meeting with principals, looking at the priority alignment. You want to look at that example?
You want to go ahead and click that.
Yeah.
So
This is one
Bloomfield
example.
Elementary, we just got talking Bloomfield, but essentially this is what they'll all look like, but it allows you to see, so part of that budget was $5,000 toward teacher leadership stipends. I don't know if you remember that conversation, that was part of it. So you'll be able to go through here and see how they're allocating. So if student caretaking is a priority, this is what teacher leadership roles look like as part of that. And then you're also able to see, that's their Section 6 budget, so how are they allocating funds towards certain things. So Bloomfield we just got done with, but hopefully by like next Friday, so definitely before the meeting, you'll be able to go through all of the list and see all of the schools.
Very.
How they do that. That's coming directly out of the other slide that you guys saw earlier, that was their, we're calling their backpack plan, so it feeds this slide. So the priorities are the same.
So you will also have access to a full Munis report prior to the board meeting. I know that you guys will spend all kinds of time reviewing that. It'll only be. But we're in a good place financially. Our projected revenues will cover our projected expenses. It'll allow us to increase our contingency to about 2.5 million, which will allow us to cover payroll expenses for a full month in the event of an emergency or a delay in state funding. And I feel like that's a strong percentage that we need to maintain.
What's
We're only
that?
required to do 2%, but that will never cover.
What's that percent again? That we will have as a
I won't know the
contingency?
exact percent until
But
we're finished, but
roughly.
it's about 2.5 million. I would say it's close to about 7-8%, because
Okay.
I think that's, you have to be able to cover payroll in the event that you have no money coming
emergency,
in.
yes.
And our payrolls run about $2 million per month, so $2.5 million allows us to cover that in the event that something happens and we don't have funding coming in. So that's why currently we have 2.16 million. I do expect a slight increase at the end of this year, and then we'll be able to add a little bit more with next year's budget, so that I feel like we need to maintain that 2.5 at a minimum.
Well, I agree, even though the governor has different ideas sometimes, I think for us, you do need to maintain it.
You have to, so.
Yes, you do.
So that's where we are, and I will, once that full Munis report is uploaded, I will let you know,
Please do.
because I know you're excited to
You
see
got 3
it.
weeks to essentially, engage.
I had a hard time sleeping last night. I mean, I could have read it.
You were waiting for
I
it, weren't
was.
you?
I think the good news is all of the reallocation that's occurred, and the significant shifts that have happened as we rethink some of the allocations we've given to Section 7, Section 4, Section 6 at schools. Within that construct, we're still in a very healthy place, which was the point. And I think the tentative budget allows us clarity on that, which we expected all along, but gives us further clarity. I think it's really a testament to the work that Amy's done with her team and Chase and the leadership team that have been working behind the scenes to be really thoughtful in this process that allowed us to get to this place now. And this was a 7 to 8 month conversation that I think was something that's not easily achieved.
We have met with every team lead. Chase has been continuing meeting. We've met with all the principals together, and then we've been going out and meeting with them individually. We will continue to have those meetings, not even just through the tentative budget, but as we prepare for the working budget, which will be the final one that's approved in September. So we will continue those conversations. There's been a lot of focus on ensuring that we don't have anything being funded twice. So are you budgeting for it and I'm budgeting for it? Are we spending money on something that isn't achieving one of those district priorities? Because if we are, then why? There's been numerous conversations across the district, and they've been really healthy and good, and open our eyes to things, open blind spots that we've had, and so it's been very meaningful and has brought us a long way.
I'm excited too for you all in May when I do the Ignite presentation. I think some of these things we've talked about in the budget will come to light through some of the things we're going to discuss with literacy and technology and some of those things as well, which will be fun to see.
Well, I just think as part of transparency, it's a good thing. Because people want to know where the money is. I mean, you turn on the news and there's a lot of unnecessary things going on. And so you would like to say, where's our $1.98 going? You know, that way we'll know where it goes. And if somebody asks us something, then we'll know what to tell them. It's hard to say, I don't know, or call somebody, but this way I feel better about it. Thank you very much for your hard work. Appreciate it.
See, our time together wasn't so bad.
No, really wasn't.
No, it was good.
I just can't wait for the Munis report though, because that's.
I will let you know as soon as it is
I'm
available.
sure you will, just as soon as it hits. Okay, Jessica, you have 3 items: CEP update, equipment grant approval, and nutrition services equipment, RFP.
Okay. So I wanted to follow up from our January conversation when we were discussing possibilities of CEP schools and adding additional schools. So the data is always reflective of April 1st of every school year. So first, I wanted to this is the schools this is all of the schools, what the current identified student percentages, which is what determines if a school's eligible for CEP. The ones that are bolded are the schools that we already have in place with CEP. If you'll pay attention, Foster Heights Elementary and Old Kentucky Home Middle School are the 2 that I'm going to really focus on. But at first, I just want to look at our current reality with the schools that already have this program. So the 5 schools that they are currently all grouped together, so they have an ISP of 50.15%, and so that means just kind of determines our claiming percentage when we serve the meals. So I kind of took the opportunity, and I'm not going to spend too much time on this, but I looked at, what if we just added 1 school, what if we added both? So Foster Heights could stand on its own with the ISP that they have, which is good news, but we really want to try to extend this to as many schools as possible. So what I focused on was how can we make this a reality for Foster Heights and OKH. So to do that, we would group the schools together, and they would qualify. Then I started looking at, okay, so how can we make sure that we're going to be able to sustain by adding these schools? And looking at the current lunch participation, we're doing pretty good at those schools, and I definitely anticipate, I want to say 10% increase. And then started looking at the
current breakfast participation and saw that that was going to need a pretty big increase. And I see your all's faces. So the sustainability for both, 75% participation at lunch, 70% participation at breakfast for each school. Broke that down for about how many more kids do we need to feed each day. And as you can see, breakfast is over 100. So is this possible? It is absolutely possible, because we want to reimagine what breakfast looks like. And I have seen this in all kinds of other districts. I've talked with the principals, and it's an ongoing conversation that I'm going to have of this is how we can make sure that every kid is benefiting from this program. Because when you're in a CEP school, it's not just lunch at no charge, it's breakfast too. So we want every kid to take advantage of that.
Is some of this also based on the consulting work with the?
This is actually not.
Okay.
So they're still working on their recommendations. But this is just something that I've really kind of been pursuing all
Okay.
year and working on, and something that I want to implement at multiple schools next year to really see an increase in breakfast. Because it's going to look different in every school, so there's definitely going to be some trial and error with it and a little bit of tweaking. But there's second chance breakfast, grab and go, breakfast in the classroom, and it's really just a conversation with principals and working with teachers to make sure that everybody is feeling good about it.
Who determines what the options are for the kids to pick? Because I don't expect my 9 or 10-year-old to go through and not pick the Pop-Tart. And I don't want her eating a Pop-Tart every morning and being all jacked up on sugar before she goes into school.
Yeah.
So I tell her, no, you cannot eat breakfast at school. Who dictates those choices that are there for the kids to go through?
So it would essentially be me.
Okay.
With the help of my team as well. So definitely take their input.
She'll make sure your girl doesn't get a pop.
But we do work. I have to say, we worked really hard to really revamp that breakfast menu, and that was one of my things, was to more variety.
Less sugar. But the option is still there. Or
On
is it
certain
just-
days, but not every day. So it would be different.
Jessica's covered a lot of ground in 9 months that she's been here, literally and figuratively. How many districts do you think you visited in the past 9 months?
Probably 10, 15. And yeah, multiple phone conversations as well. Just seeing
Really
what
going after some of the more high-functioning food service programs across the state, learning from them, really sitting down with food services leaders and picking their brains. It's gotten us to a place where I think we're primed for some putting people first.
Have you seen some other districts with breakfast percentages?
Yes, so Davies County actually started, they implemented breakfast in the classroom at just one of their middle schools. Participation tripled, went from 24% to 75%.
So I was a principal at a school that had a second breakfast, and the benefits of that, you can't really fully articulate, but the great part was, especially the high school principal, but I think it's true for everybody. You know, you're running around, you're trying to get to school on time, and you get there and there's not time, and that extra boost, I mean, it was great for the kids holistically to be able to have breakfast options. And you know, the great part too, as I told Jessica, kids would go through the line, and so their participation, they were going through the line, but you know, they may not have eaten it. There was a share table. There was people that you could share with each other. Kids that wanted extra food that maybe didn't have it. It was a great choice for a lot of kids. So I saw it as a high school principal, and it was.
Well, and imagine that you would probably have to build trust with the parents too, you know, that they're not getting a Pop-Tart, you know, every
Every
day.
single day.
Yeah, and that they are eating healthier and, yeah.
I think about that kid though, who gets on the bus at 6:15, 6 o'clock, 6:30, and then they may have had a Pop-Tart when they went out the door, but then when they got to school, that Pop-Tart doesn't go that far, and then lunch is not till 11:30, 12 o'clock, 12:30, and you're finished. I mean,
Yeah.
kids are just hungry, you know, until you get to high school, and then they watch the weight and carry on, but when they're smaller, they're all hungry. You know, I think it's wonderful, I think it's great, in the classrooms.
I don't know, I ate lunch at Boston today and was it
good?
It was great, and it was, there was a raw fresh vegetable option that had green peppers, carrots, cherry tomatoes in it. I mean, yeah, I mean, it was, and I watched, and the kids were eating it.
And
You
that's
know?
what you want.
Exactly, it was, and there was absolutely nothing wrong with it. It was really good.
Great, that's good. Keep it going, Jessica.
Mhm.
Good job.
But I've got a great team. I can't take all the credit. They've really made these changes happen and have really taken pride in their work. So with that, there was no really decision. I just wanted to update you all on that, but my recommendation would be to go forward with the 2 schools. So that would have, we would have 7 schools. That would be C2.
Good. Okay, now it's for the second.
Okay, so the USDA selected Kentucky to receive federal funds for National School Lunch Program Equipment Assistant Grant, and KDE awarded these funds by a competitive grant process, giving priority to high-need schools, and one of those requirements was that it met the 50% free or reduced rate. So we were actually notified that we were selected, New Haven School was selected to receive $25,000 for a commercial dishwasher. So there's no action needed, just requesting your all's approval or acceptance of this grant at the regular board meeting. Yep. Excited. I
had a couple guys
very
making that dishwasher, they worked off so much.
I had some very excited ladies at New Haven on the relations too.
Yeah.
And when we say new dishwasher, we don't mean Kevin, right?
Yes. So, as we continue with that, any of the food service equipment that exceeds $20,000, we do have to procure that by formal procurement via an RFP. So this RFP has to be advertised for 7 to 21 days. So the first RFP is for the commercial dishwasher at New Haven School, which will be covered by the grant funds. The second RFP that we do want to advertise is really just so that we can kind of get clarity on the price of certain equipment, because there's 2 schools, New Haven and Nelson County, that would really benefit from upgraded equipment. We just really need to see kind of where we're at. So we want to put out an RFP for different equipment, then kind of get the quotes back, compare, is gas going to be better, is electric going to be better, where are we even at with our budget? So it just seems like the right time to be doing that. So again, no action needed at this time, just for them to request your all's approval of advertising those RFPs.
Great work.
Thank you very much.
One thing we will look at, me and Jessica's trying to find the options. If we run electric, what's it gonna cost us to run electric and get rid of propane at New Haven? So we're kind of weighing those options. Get rid of that propane and go electric down there.
Is that the only thing that's using propane at New Haven is?
No, we have hot water heaters
Okay.
too, but that would be a big help.
Yep.
As you know, that one year propane went sky high on us.
Yep.
Couldn't get it, and we had to use Bennett's. You know, they jumped in and helped us out a bunch. So anything we can do, if it's a cost savings, we'll go that route.
Okay. Thank you. Okay, next under student and shareholder engagement, we have Dee Furman, and that would be our Mr.
So
Brackett.
we'll set the timer for 10 minutes. It's always my favorite part of the month. They're getting their books down. They're not leaving.
No, I was kind of leaning in here because I think Rebecca's going to take the lead on this one.
Yeah, I've got intricate notes.
So, you know, it's funny, we've been, catching,
No, I got it.
All of us too, huh?
No, I really did.
Yeah.
So, I just want to say that we as
It wasn't a very big chapter.
No, it wasn't.
It's a short chapter.
we met today. We meet every week to talk about the work going on in Pride teams. I'll start the timer here. Be quick.
And you can see our notes from today's meeting. So,
Really nice.
part of what we do too is we look to build out this paradigm, which we're calling our backpack conversation with the pride teams and defining skills. Part of what we did today was we looked at why are we doing this, and what does it look like over the next year? How clear are we on that? And then we went back and took alternative viewpoints and said, what would all the people that disagree with this say? And that's really just an example of the type of stuff that leads to this type of conversation. So I say that to say, feel free to poke holes in this book, and as do we. The more we think through it, the more we recognize some of the unique tensions that we are going to face as we continue to develop this model. So, have at it.
On page 45, that was the first thing that I found very interesting because the very last sentence there, the last complete sentence on the bottom of page 45, actually defines deep learning. So that's something I had been looking for, was trying to define what is deep learning. So if anybody hadn't caught that was what I found to be very beneficial about this chapter that didn't, you want me to keep going?
Leave it to the lawyer to find that, haystack there.
I've got more.
Yeah,
Well, go for it.
Well, on page 49, you'll see, like in the middle of the page, and I don't say the word right, it starts with a P, that word, yeah. Students aren't attached to the status quo, especially when they're little. So how do we change the adults? The book raises more questions for me than it does answers, and really they make more questions for me to ask you. Because how are you going to lead that change?
Part of our conversation today was why are we doing any of this in the first place?
Why are we?
So I think part of it is really to ensure that we are uniting around a shared purpose. And Robin Hanlow just said something really important, is that you can't really have a community of people working together without a sense of purpose, a shared purpose. And then to go deeper into this conversation, we have to begin to have a shared language and a paradigm to work within. So I think I think in the end of the day, that's our why, right? So our shared purpose is excavating gifts, but this process is just as much about refining that purpose as it is this end outcome. So
is it through community involvement and transparency that we're going to engage the adults to get them to change their thought process on the status quo?
So I think that we talk about excavating gifts and empowering lives. That's a compelling story. When you say every kid's gifted, it'd be hard for Damon to say, well, what about this kid over here? Yeah, gifted. Well, let me tell you how. We know the kid. Like, we've given this kid opportunity. Here's what we can speak to him. So I think part of it is we're creating a construct that is really about putting people first and compelling people to engage in what we feel like is something you can't necessarily argue against to a degree.
I think it's also about the invitation for people to be a part of it, through pride teams, community brew, and externships, and this community foundation work with literacy and these different things about allowing people to engage in a conversation about all of this stuff where, people, I think we see that, especially Laura's work too, like when people don't have an invitation to be a part of something, it creates this like barrier almost. So I think that's really important piece of it too. Like, how are we inviting community and society and parents and all sorts of different people to be a part of something that we're doing?
And if you're not being, what that makes me think of is if we're not intentionally being exclusive or inclusive, then are we intentionally being exclusive? So intentional inclusivity and community building.
So those first three sentences of that paragraph under pedagogy. So essentially it's saying, once the students have this kind of an experience, they will not go backwards and they will expect this. And in fact, they'll be the ones that look at the adults around and go, you're either with me or I'm leaving you. Because this is what I'm expecting now.
They're going to demand it.
I think I can speak for everybody in the district to say that the conversations that we've had this year with teachers and adults throughout Nelson County while they're not, may not say it directly to me, I feel like have been well received. People are excited about the conversation, and people get it. I think this is a conversation that's been emerging for years, and now by continuing to say, what's the purpose of school? People get it. Like, people, they understand that it's bigger than just teaching some content that we may have thought it was 25, 30, 40 years ago.
You know, and almost too, I mean, in a very practical sense, you know, so 20 years I've been in ed technology, education technology. Not until about 3 years ago did I truly start leveraging the collaborative capabilities that we got in it. And it wasn't because all of a sudden one day I said, hey, you know, yeah, this is cool, I'm gonna do this. It was because there were other people around me that were doing it, and that's what they started expecting. And they looked at me and they said, either you're on board or we're gonna leave you behind. And now I've got, you know, Google documents out the wazoo that today someone in Frankfurt said, hey, if any of you all out there in the field have these kinds of things for your districts, I just, on my phone, I went to the team drive, grabbed the document, shared it to him, and wrote him a little note and said, here's what I've got, this is what you need. Instead of the old way of, well, let me go back to my laptop, let me do this, let me create this spreadsheet, let me email it to him, or print it out and, you know, mail it to him. And so I say that as the example of very practical. Once that kid has left that worksheet, once that kid has that deeper learning experience, they won't go back. I'll never go back. I mean, I can do pretty much everything I want to do right here that 5 years ago I had to have a laptop and I had to have all these other tools to do.
I still need that tools to do because I don't do that on the phone. My idea of this whole deep learning, yes, and I think we've talked about this. I want students to realize that there's more out there than just up to them. I want you to care, me to care, you to care, you to care, you to care. Everybody cares, okay? And that student's self-worth becomes more valuable to that student, that they want to do better work because they've got all these people that care about it, just not family, but teachers, administrators, that kind of caring. In my eyes, that's what I expect in Nelson County. I expect that we can all learn together, and I know this sounds silly, but love together, so those students love themselves enough to care about what they are learning. And that's where I think we lack. It's just not our district, it's everybody's district. It's the world. That's it. It's become like I'm in this alone. I mean, and I've heard kids say it. I'm alone. Number one, their parents don't, it's not their fault. It's not the parents' fault. They don't know how to help their kids because they don't know how to help them because they don't have a higher education. They don't, they don't understand a concept. It's just not mom and dad. We have to all gather around
I think that's why.
and make it work.
I think that's why the language we use that says community-centeredness is so important, because it's not Diane on an island trying to influence the life of a kid, but it's Diane and the person they work for and the principal and the teacher and their mentors and their church family and their, all these different groups of people that are surrounded.
I think it's 21 speaks to that pretty much. When you think about our core values and how it's constructed, and I'll tell you, this entire paradigm we're building internally is built around this sense of well-being, which we put within the construct of put people first. That says a positive sense of self, spirit, and belonging that we feel. That is really, we know, first and foremost for all of us, especially when we're younger. So
Yes.
this model depends on that. If you look at the work that Robin's leading, many of our principals are leading around student caretaking across the district, it is directed towards this. And I think teachers get it. I think principals get it. And
I guess I say, that is why it's the P in pride, is we know that's where it all starts, compels us forward. There's a lot of great work going on out there right now in our schools. With this work, it's going to continue to grow.
Third.
Yes, Dr. Pinkley. I'm just curious, I mean, I'd be interested to kind of see her, or listen to her thoughts.
They did their first, what I consider to be collaborative deep learning project. And it was then they've been working on it, through, I understood what it was a plan of vacation. So it really hit on a lot of things. They had a budget and they had to plan the vacation, and they each had to, and they did their presentations, and they did oh yeah, she loved it. Oh, she was excited to go. She was nervous. It was all the good things that I would want her doing in school. And I'm going to repeat something that I overheard today, because for all of y'all in the room, sometimes if you wonder if it's working, I was minding my own business, as is my habit, at a local nail salon.
Hold on.
At a local nail
Let me write
salon,
this down.
I was minding my own business, and I started listening because I thought, oh God, I'm sitting here in the corner. I don't want to hear this, because I started hearing somebody start talking about the schools. And so I thought, I'm just going to listen and see what she says. I'm going to guess this person. What I know about her is she lives, because she says she lives near Balltown. Heard her telling that. She is a bartender somewhere outside of city limits. I'm going to say mid-20s. Has kids in the school system, 2 different schools. And what she said was, I sure wish that they had this when I was in school. And what she was talking about was the workforce development. She was very clearly talking about opportunities that her child was getting to learn about the community, local industries, all these things. And she said, I sure wish that they had that when I was in school, because I thought I had to go to Louisville and work, that I couldn't live here and work around Bardstown and not do what I'm doing now. And she was apparently having a conversation with somebody else that she had gone from high school with, they hadn't seen in a long time. But when I heard her say that, I thought, oh, all right, I'm going to repeat this story. That's a good one. So yeah, I mean, it's out there. Parents are saying, I wish they'd had that when I went there. So people are noticing this.
Sounds like
So strong work. Thank you all.
Sounds like we all need to go to the nail salon.
Probably, you should.
She was in her 20s.
I don't know. I didn't look at that close. I mean, I'm guessing maybe
felt-
late 20s.
Only reason I say is, I found myself saying the same thing, and I'm in my 40s, so.
You're not in your 20s?
No, I mean, yes.
Yes, we are.
Times 2.
We're close.
So I think the nice part is it's May. This conversation in this book will really continue for the next year. It's not going away. In fact, I think the best thing we can do is stick with this as a team. We are just beginning to understand it ourselves, and I'm gonna have to go back and reread it as we dive into this next phase, because I understand the book more deeply now than I could have the first time I read it, because I understand where we are as a district more now than I was. So while we don't agree with everything in the book, we actually feel like what we're doing is building a bigger construct in a sense than what they're doing here. We do feel like it's a great compass for us to give us a value construct. So.
You gotta make them care. You gotta make them care. You gotta make those kids care about their lives.
Well, you mentioned it matters. I mean, it's just,
It
once they're
does.
engaged in learning that matters, if they matter, then the education, if they buy in that it matters, then it all snowballs from there.
Yep.
So,
It all goes hand in hand, what I think. I agree. Yeah. Okay, very good. Next, we have guest comment, and do we have a guest out there? Well, then, meeting adjourned.
Need a motion.
Oh, I'm sorry.
Motion.
Thank you. Second?
I'll second.
Okay, thank you. Ms. Breeding, second. All in favor? All opposed? Meeting adjourned. Great job.